So when a patient comes, as Ms. Nibi rightly pointed out, there are a lot of things that they are going through. At first, the diagnosis in itself, then we start digging into their history and then telling, yes, it might be a gene that is running in your family and that might have caused you this risk. So they're really alarmed. So one of the alarm that causes, and I have instances where, patients actually break down telling that I shouldn't be infecting my other family members. When we try to tell them, no, this is not an infection, this is something which might be there hidden in your family. You have just kind of manifested with the cancer, and there may be so many other family members, that can be rightly detected, screened at an early age. You have been diagnosed, we could screen them at an early age and detect it at an early stage. That's what we try to convince them with. Second thing is, most of the young women who come to us are married, they have children, so their next concern is what is the risk to my children. So that is when we also tell them that we first test on you, and then if it is positive, then we test on your siblings and children. It doesn't mean that it is a 100% thing that your children will get affected. It's a 50% chance, so we need to test and see. So science makes it easy. You need to take help of science, get the information right, talk to our counselors, discuss with us, and then do the right move. Third thing is, in a family wherein there are multiple family members affected, one of the concerns they have is if this causes some marital discord or something like, first of all, the women themselves feel the diagnosis is a burden to the family, because they've almost always the women have been giving. They've never learned to take from something. So the time they are sick and they have to take rest, and they're dependent on their family members to take care of them medically or physically. This is one of the things that revealing to the family members. How can it be revealed to the family members? How will they take it? What are they going to tell? So the fourth scenario is in a carrier. Like we detect elderly lady with cancer. There is a particular type. We test for gene. She comes to be a genetic positive. Then we test their family members who are still not manifested with the disease. They are called as carriers. They still have the gene with them. It is not still caused any kind of events in their lifetime, but yes, it can cause. So then we need to counsel those family members as well whom we test. What is that they need to do, screening wise, detection wise, any prophylactic surgeries, any kind of chemo prevention, or any medicines they can take to prevent such cancers. All these questions come.